On a marketplace plan, you would have to have a qualifying life event. And what I mean by that is,
Malia, it's great to have you back. I'm really excited to chat with you today. And I wanted to have you on because open enrollment just ended. And we're trying to figure out now, what do people do if they missed open enrollment?
that is a great question, Jason. We still are getting calls here and there from people who actually miss open enrollment. And so there's two types of open enrollments we're going to discuss today. So the first one would be if you were trying to get on a marketplace plan, you're not on Medicare. For most states, there are still, like California is still open right now, but most all the other states were done January 15th. The first thing is if you miss open enrollment, at this point, if you want to enroll on a marketplace plan, you would have to have a qualifying life event. And what I mean by that is something in your life had to have happened that have caused you to either lose coverage or now you need to make changes. So it's going to be something like you had a baby, or you got married, or you moved out of the state. And the key thing right there is it can't be like two people who didn't have coverage before get married. No, that doesn't qualify for them to both have open enrollment at this point. It's just you have to have at least one person be covered. And so same with having a baby, at least one person in the family had to have coverage prior, and then at that point, if you have a baby, then everybody else can hop on. There's also a newer special election period a lot of people don't know about. If your income is below 150% federal poverty level, then you are eligible to enroll for a special election period as well. So that's for the under 65. Now, Medicare is a whole different animal, and with Medicare, it depends on your current coverage. So if you are on original Medicare with the supplement, then you can't make any changes to drug plans at this point. However, a lot of people don't realize that if you have a Medicare supplement, you can shop that year round. So if your rates increase on a Medicare supplement, you can still go through underwriting and shop for something better. And then if you're on an Advantage plan for Medicare, then right now, a lot of people don't realize this, but you have till the end of March to shop and get onto a different Medicare Advantage plan, or you can switch back to original Medicare and get a drug plan as well. Other than that, you would have to have, again, a special election period, like moving outside of state, in order to make any changes.
Okay, great. So we're hearing a lot in the media about layoffs, especially in the tech space. If someone were to get laid off, obviously they might have something like COBRA that can hold them over for a little while. But if they didn't find a job by the time COBRA expired, do you have any information on how that might work?
Yes, so I'm so glad you mentioned COBRA, because a lot of times you would want to compare the COBRA coverage to see, do I want to go on COBRA, or is it better at this point to buy my own insurance or get on Medicare? And so the general rule of thumb is if you can qualify for a subsidy, then most likely then the marketplace plan would be the way to go. If you cannot qualify for a subsidy, or sometimes you take really expensive brand drugs, Medicare is not going to cover your drugs very well, then you're better off going on COBRA. And so we're going to do baby steps. You lose coverage, you figure out which is better for you, which route to take, and then as soon as you're getting close to the end of COBRA, then you're going to want to reach out and shop again for your own coverage.
Okay, great to know. So it's really not a one-size-fits-all situation if you were in that job loss, layoff type of scenario. You really want to compare, because COBRA can be very expensive. Could be great coverage, but maybe you don't need quite that level of coverage, and you can save a lot of money by shopping your plan through the marketplace and seeing what makes the most sense for you. Does that sound right?
Yeah, and you brought up a really good point about COBRA coverage. Sometimes even if you do qualify for a nice subsidy, you may want to keep COBRA because maybe your doctors don't take any marketplace plans. And so there's so many different factors when it comes to shopping your best option. But the thing is, once you decline COBRA, then it's not like you jump on Marketplace and 5 months later you can jump back on Cobra. So you definitely want to make sure that you have looked at all your options and ask those tough questions about, is this going to cover my prescriptions? Is this going to cover my doctors, before you decide?
Yeah, and I think that's a point that a lot of people don't totally consider. And I even seen this with financial advisors. They just tell people to hop on healthcare.gov and go find a plan. So I really believe in the value of getting consulting advice around really designing your plan that makes the most sense for you, and then make sure you're not missing anything there, like the doctors that you want to have, for example, being available under that new plan. So that is a big part of the conversation.
Yes, thank you. Thank you, Jason. And it doesn't ever cost anything to use a broker. So it's just nice to have that second pair of eyes that's experienced. And so, yeah.
Yeah, so let's just ask on that real quick, because so many people think they're gonna have to pay more for their plan by using a broker. Is this really as clean as it sounds? Like the government actually just, pays you guys something on the back end, but the plan price would be the exact same if the client found it on their own versus working with someone like you or another health insurance broker?
That's a great point, Jason. So should never be any cost to using a broker, because what happens is if the broker finds you a good fit and they bring you to, Blue Cross Blue Shield or Aetna or some other carrier, the carrier will actually compensate the broker for their time. So you never have to worry about paying a penny more. The other thing too is if something goes wrong, you have an issue with claims, the broker is there to go to bat for you. They are the ones that have experience with claims issues, and they'll know the ins and outs on how to help you navigate through that.
Well, that's a really good point. I didn't think about that. And I know I've used mine in the past, just to even call and ask a question, say, hey, I'm thinking about switching because of A, B, or C. And I was able to get that direct answer versus spending probably hours on the internet and maybe not even finding the answer. So really, really good advice there. I have another question for you though.
Yes.
So what happens if now open enrollment is closed and now you find out that you need a expensive drug, for example, that wasn't really covered on the plan that you might have selected prior when open enrollment was open? How is somebody supposed to deal with that?
Yes, and unfortunately this does happen. We don't have a crystal ball at the time of selecting your plan. You may be completely healthy, and then in January, February, the middle of the year, you start being prescribed something that's a brand drug. There's several ways that you can mitigate this. First of all, a lot of people have heard of like GoodRx and CleverRx. And this is something that even people who maybe miss open enrollment and they don't have any coverage, they can use those, discount copay savings card type things. The other thing too is talk to your pharmacy, because a lot of times Walmart or Walgreens, they'll have their own program where you can get 90-day supply prescriptions for, $10. So I'm not saying don't buy coverage, but if you're stuck, there are other ways to get your prescriptions. There's also rxassist.org, where you can actually apply for patient assistance. And what that is if it's a really expensive brand drug. Some of these drugs I'm seeing cost, $8,000 for a month's supply. I don't know who could afford that, but you can go through that website, download a form, and you're basically applying for help through the manufacturer. If you're under a certain income level, you could get that prescription for free. Also, there's something called the 340B program that a lot of people don't know about. It's certain clinics and hospitals that are able to give patients, 20 to 50% off discount, because it is subsidized by the program for some really expensive drugs. So you might want to get with a broker that is knowledgeable about those programs, who can direct you. Here's a list of hospitals that you can reach out to. And if you're on Medicare, you can ask your broker for help. Ask them for help applying for a formulary exception or a tier exception, which might help you get through till the end of the year when you can reshop again.
Okay, great. Any last thoughts on how to handle the situation where somebody is dealing with open enrollment that we need to add, or do we cover it all?
We pretty much covered it all, but the main thing is to make sure that when you're reaching out to a broker, make sure that they are able to shop different carriers for you, that they're not just captive, meaning that they only work for that one specific carrier, because that's going to make a big difference. And experience is everything, because experience is what's going to get you the broker that will help you apply for these programs if needed.
Okay, great. So if there were maybe 1, 2, or 3 questions somebody should ask when they're going to try to find a good broker that can help them, what are some good questions they might want to ask?
Okay, so maybe just ask them just flat out, hey, are you a broker that can shop different carriers for me, or are you just with one company? That's like the biggest, tell reason. And then a lot of times it's word of mouth, So if you have a friend or family member that has a broker they're really happy with, then it's a lot easier to get that name, And of course, be patient, because sometimes the experienced brokers, it may be a little bit tough to get a hold of them because they are in high demand, but it will be worth it for you to wait, maybe a day or two to talk to them, because then that broker will be with them in the long run. So yeah, and it's good to know, is the broker independent or do they work for a call center? If they work for a call center, they may not be around in the long run.
That makes sense. Yeah, very good. So if someone has questions and they wanted to ask you personally or your team, what's the best way for them to get a hold of you?
So they can reach us at Medigap Pros 800-850-9657.
Wonderful. Malia, thank you so much. And thank you for sharing your knowledge. And I look forward to having you back on very soon.
Thank you, Jason. Thanks for having me.